My patient care philosophy that I've developed over many years with patients is to be engaging with the patients, to spend time with them, to listen to their complaints so I really understand why they're here. Once I understand what their problem is, then to develop first a diagnostic plan, examine them, decide where the real problem lies, do appropriate testing, and then once we have a diagnosis, then to develop a treatment plan by discussing with the patient what the options are and what the patient's preference would be. Emergency medicine is an extremely exciting way to practice medicine. It's always challenging, it's straightforward, and it's extremely rewarding because you get to know if you made the right decision, the right diagnosis. You get to make people feel better immediately, and hopefully they go home realizing that they've had their problem taken care of. I think my patients would describe me as someone who is very straightforward, very goal-oriented. I listen to what the problem is, but I try not to stray and talk about golf or other things that may be of interest but really don't have a bearing on the current problem. But once we have a diagnosis, then I try to be, again, very engaging with the patient to understand how they would want their problem treated, because there are many ways to treat a situation, and they all may be right. The most rewarding thing is when I go home at night to think back on the patients that I saw that day and realize I've made a change in their lives, a positive change, and made them feel better, took away the fear, which to many patients is the most important part of their illness, is the fear of the unknown. And so I try to educate my patients. I try to make them understand what their problem is and how we can solve it.